Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello, everyone. My name is Adrienne Asta, licensed massage therapist and president of the Massage Therapy Foundation. And you are listening to Research Perch, our free podcast from the Massage Therapy Foundation. And today I am thrilled to have as our guests Dr. Sarah Fogarty and Dr. Cynthia Price, who are here to talk to us today a little bit about a special issue of the IJTMB that is coming up early next year. I think it is slated for. So before we deep dive into this special issue of IJTMB, Dr. Sarah Fogarty, why don't you introduce the audience to yourself and let them know how you got to the position that you're in today.
Hi, I am from Australia, so it's opposite sides, opposite seasons, so into summer, which is joyous. I started as a massage therapist about 25 years ago. I have always had an interest in research. I did my master's, I did a PhD, and just slowly worked my way into different aspects of research and different things, particularly on the pregnant population. And that led me to be on the board, or as an editor, for IJTMB. So that's how I got myself here.
Awesome. And Dr. Price.
Sure. So I'm a research professor at the University of Washington in Seattle. And I started my massage training in 1981. So that's a really long time ago. And was in private practice as a massage therapist for 20 years. And in that time period, got a master's degree in counseling psychology and really focused my work in the mental health realm, still doing touch-based work, but really working with people who were struggling a lot, particularly with trauma, and then went on to do a PhD and research that has always focused on sort of mental health and physical health, sort of co-occurring kinds of conditions that people struggle with. And so that's kind of where I come from.
Excellent. Thank you. Now, when we talk about mental health, and to massage therapists practicing it everywhere, even to massage students, and I would even think to people who are just aware of the benefits of massage therapy, that of course there's going to be a mental health impact after this exchange. And Dr. Cynthia, we had you on a previous Research Perch podcast where we talked a little bit about the work you do for training massage therapists and how do we toe that line with scope of practice, right? So I think this certainly as a practitioner gives me pause, right? Where's that line based on my level of education and my, relationship with that client? It's so nuanced, this subject matter. How do we even start? So when we talk about massage therapy and mental health and scope of practice, what tools are we using that's in our scope to measure this thing that is, we're doing a call for papers for the IJTMB, right? International Journal of Therapeutic Massage and Bodywork. It's, kind of conjures images of work with the somatic part. So what tools are we using to measure the research we're doing with massage and mental health? Sorry, that was really long-winded question. I'm trying to translate for the practitioner, right, who's going to listen to this podcast and take it back to their room.
Right. I think I'm going to start, because you started with scope of practice, but I want to get there going the other way, which one is talking about what are we looking at? When we're talking about mental health, and we're talking about measurement, from a research perspective, or even qualitatively thinking about themes that come up if you were to interview your clients, right? About what are they getting out of massage therapy? And on chances are there's going to be some mental health pieces of that. And so when we think about what does really mental health mean, right? It's so big. And that's part of what you're talking about. It's so big, right? So it can include your response to stress. It can include we know pain is biopsychosocial, right? So if you're someone who's coming into massage for pain, it can include how you manage your pain because your relationship to your pain is better. Well, that for me falls in the mental health realm, right? So management, our ability to regulate and emotionally regulate in response to stress is so much out of our awareness being increased, and our sense of capacity to attend to what we need being in a better shape. And that's a lot of what massage therapists are doing. So that is mental health, right? So we can talk about those kinds of big picture concepts. Those are measurable, as well as really going to does anxiety symptoms decrease on sort of a standardized measure of anxiety that might be used more in psychiatric research, for example. But I think, so it's important to really think as broadly about mental health as it really is. And I think that helps us understand why we can talk about this as massage therapists, right? We know it's affecting people's mental health. And we know that we're not psychotherapists, most of us. And so what are we doing, right? We're helping people a lot of times manage their distress better because they're more aware, because they're less stressed, because they're learning tools to take care of themselves better, including just getting touched, just having someone help relieve their acute stress, right? So there's that. And then I think what you were referring to in terms of scope of practice, Adrienne, is, and this applies to the work I do, where we're doing more verbal interaction with our clients and doing more teaching that's psychoeducational with our clients, which a lot of body workers do, right? Is rather than talking about their story and their history and asking them the kinds of questions a psychotherapist might do, if someone brings that stuff up, we're coming back to the body. And it's like, well, how are you feeling in your body? How is that feeling in your body right now? Where are you feeling that in your body? We're kind of turning the focus back to where it is our scope of practice, which is how are things showing up in the body. So that's my answer to your question.
Amazing. Great. Thank you. Sarah, anything to add? I mean, that was so chock full of of exactly what I was looking for. Okay.
Amazing. It was lovely.
It was lovely. Yes. Thank you. Okay. So why, I feel like this is an elementary question, but might have a bigger answer regarding the type of research that we're doing in this area, this mental health, massage and mental health. It's easy for me to ask, as if I weren't a massage therapist, well, why is this important, right? So for someone who might not have their eye on the mental health benefits of massage therapy, why is it important that we include this type of research along with the stuff that we have been seeing with massage therapy, how it works on maybe, orthopedic conditions or cancer conditions? This to me seems like an obvious yet relatively new path for massage research. So why do you think, as editors, is this important to do this kind of research?
You start, Sarah.
Okay. This is I guess from a more personal than a research point of view. I think it's important because I think that biopsychosocial model is so important in massage. It's people are more than just their sore calf, and sometimes they just are a sore calf, and that's fine too. But they are that sense of we're working on well-being, quality of life, all of those aspects, I think, make any therapist, generally in any profession, in health profession, but particularly in massage, we have this amazing capacity to spend quite a bit of time with someone, and we have that lovely element of touch, and that capacity to listen and to hear a little bit about their story and have that time to find out what is happening, how their sore calf might be impacting their quality of life, their ability to exercise, which then might mean they've got less endorphins, dopamine, so they're feeling a little depressed. All of those type of things are such an important part of massage in general. I think that I feel like the research perhaps doesn't capture some of those more important aspects that massage doesn't always capture some of those important aspects of massage. It is, I believe it's a more than a hands-on sort of treatment where we are, spending a lot of time and energy and interaction with that person. And that therapeutic relationship, I think, is such an important part of massage therapy that I think it's important that research, I guess, maybe reflects what might be happening more in clinical practice. And there are elements where it's amazing that we find out the little minutiae about how it works and why it works and what it does. But also I think it's important to capture that clinical aspect of all the care that we provide as massage therapists.
Yeah, what you said reminded me of, kind of this new focus at the National Institute of Complementary Integrative Health at NIH, which is on whole person care, right? And that's what massage therapists are so often doing, is whole person care, and that's what really you were talking about, Sarah. And I think that does get lost. It gets lost in randomized controlled trials, right? Because you're so often focused on these very specific outcomes and not the processes involved. And I do think that for this journal, having people send in their ideas, the special issue, their ideas, and there could be some conceptual pieces that are really addressing this. What is it about massage therapy that's whole health? What is it about the processes that are supporting mental health? And I think we're not only have a large gap in terms of the kinds of research that's out there addressing mental health, but also the conceptual foundations that really provide the kinds of constructs we need for research that are about this issue. And there's we need a lot more people who are up for writing about it and thinking about it, to really do so, because it will support our field.
This is a great segue into diving a little bit deeper into the request for this special issue of the IJTMB. So first of all, the International Journal of Therapeutic Massage and Bodywork is a quarterly journal. It's fully online. It's open access. It's peer reviewed. And it is, so open access, peer reviewed, quarterly, fully online, and full article, right? So you're getting more of the abstract and free. Oh yeah, free, that part. That does not cost you anything. Thank you to the Massage Therapy Foundation and the Registered Massage Therapists of British Columbia, who sponsor the IJTMB, so it can continue to be free for you. So I'm reading right off of IJTMB's website here regarding the call for papers. We're having a special issue on mental health and manual therapies. And there is emerging research is showing that massage may play a role in managing symptoms of mental health disorders and mood conditions, but more scientific evidence is needed to support its use. In addition, massage therapy and bodywork could serve as a valuable treatment to prevent adverse mental health reactions and contribute to optimal well-being. Therefore, this special issue on mental health and massage and bodywork will showcase the potential for massage to impact the management and care of mental health conditions, as well as quality of life and wellness. I mean, this is really fantastic. So, so what exactly are good examples of what a practitioner or researcher can contribute to this specific issue? Are you looking for case reports, or like what are the things you would want to see submitted?
All of those things, really.
Okay.
Case reports, as Cynthia mentioned, conceptual ideas about how it might work. Anyone who's got research on that they feel is applicable that under this field that might want to do this qualitative research, quantitative research, reviews, all of those sorts of things. Editorials, if you feel really passionate about mental health and massage. Submitting, I think editorials are actually really hard to write, but that's it. But yep, go ahead. Feel free to write an editorial and submit it. I'm very passionate about mental health and massage.
Oh, go ahead, Cynthia.
Yeah, no, I think though, I think it's pretty broad, it's pretty wide open, and that's what Sarah's talking about. I think also, I had a thought, what was it? Oh, sort of people's experiences, for example, who have worked in conventional settings. So there are people who've worked, for example, implementing massage in hospital settings or cancer treatment settings, or where like writing about what is that like? What were the challenges? What worked? I think one of the things we're seeing, right, is more and more massage is happening in more conventional healthcare settings. And if someone could do a little evaluation piece about that, gather some data. How long has this been happening? How many people have enrolled in massage? How many have come? How many sessions? It's more evaluative kind of paper versus more a research study, but you can retrospectively look at those kinds of things that are very valuable for showing that massage within these kinds of facilities is working, it's acceptable, people are coming. And then if there are people who are specifically dealing with co-occurring or more targeted mental health concerns, you can talk about that in this kind of an article. And I think there's been almost none of these, in the literature. And it really is helpful for helping to lay the groundwork for, hey, we need to do some research. Not, this is happening. So what would be like, we've got this showing that it's happening and that it's helpful, it's working within the system. But now we need to do some implementation science research where we're looking more closely at for whom is it most helpful, and where are the barriers and where are the opportunities and what helps to sort of facilitate integration of these services into care. Yeah. So I think that's another idea that that people really may be able to write about. They may have not thought of it.
When you had said the retrospective studies, I have information from your notes, right? From notations and from intake forms, and I'm thinking to myself, I have seen an uptick in new clients marking anxiety post-COVID. And I think to myself two things. One, I'm glad people are having the courage to mark that on an intake form. And two, that they see massage therapy as a viable way to help manage it, right? So I have it in writing. So why not just like slap it on some paper? And even if it's, I'm just thinking of the busy therapist who's, wants this information to go somewhere, but doesn't have time to manage it themselves, that they have the likes of a community like ours at IJTMB to say like, hey, like I have this, is this helpful anywhere? Yeah, so any massage therapist listening who might not think they have the time, you have the information, just slap it together and send it our way. So thank you for highlighting that piece, because I think that's probably the space where massage therapists come from the most, right? It's like, hey, like I did this thing and then this thing happened. Isn't that cool? Oh, and I'm noticing that it kind of keeps happening. And then they just start to inherently see patterns, right? So write it down is what you're asking.
Right. And also if people are if massage therapists or are working in systems, for example, they really may be in a position that they could collaborate with somebody on that team who, might be more in a position to write up a piece. That they could do it together, right? About, who can like look back at, for example, electronic medical records and say, yeah, we did have 150 people come in the last 2 years who checked the box for anxiety. And yeah, 70% of them did get massage in this facility. And wow, they all came. How many times? Like, that's the kind of thing that we're talking about here, where it's enormously valuable. But often people don't take the time to think that it is and take the time to write it up. Yeah. Yeah. So yeah, I do think that if people are wondering, if this helps spur some thoughts about writing up something or asking a colleague if they could work with them to do that, and you want to run an idea by us, reach out to Sarah and I, or the executive director of IJTMB, who can help answer a question. So yeah.
Yeah, we appreciate that. There's, MassageNet also comes to mind with this. So we started our Massage Therapy Foundation started a practice-based research network specifically for massage therapy. And there was a mental health study that was implemented through anybody who was a member of that, right? So it doesn't cost anything to be a part of this network. And you're not obligated to anything. You opt into whatever might be asked of you. And I remember there was a call out for a mental health study and perceptions of mental health through MassageNet. So MassageNet's a great way for massage therapists to kind of like delve a little bit deeper, have a forum to ask that question, and be involved in the research process if they want to be. In a way that is familiar to them, which is, working in their environment, right? Wherever that might be. So the next piece is, if somebody wanted assistance with how to put this information together, you open that door there, Cynthia. I know the Massage Therapy Foundation website, massagetherapyfoundation.org, has a case report portal where you can look at all of the tools that we have on how to write a case report. I think we have a webinar in there. We have I believe, an ebook and some other things that you can reference, and that's specific to case reports. Is there anything else that any other resource that you can recommend if somebody wanted to submit any of these pieces, or I'll have you answer that question first, and then I'll ask the follow-up.
Yeah, I'm just thinking about what I was just kind of going down the road of more an evaluation of of a program. And that is a great question. I don't know if, Sarah, you happen to know, but there may be some resources out there. Unfortunately, I don't know if there are for how to do that kind of evaluation. Is done a lot by nonprofits, for example, about their services. And so I wouldn't think it'd be that hard to find online, like what is involved is sort of the basics that one would report on if one was doing an evaluation report. it wouldn't be that hard to find. I just don't have it at my fingertips. Sarah, do you know any more about that?
No, I think again it would be online or looking at particular publications that have reported on evaluations and
Yeah,
following their sort of methods and processes and how they report results.
exactly.
Would be
Yeah.
how I would do it.
I would think that this would be helpful. I know I have a referral partner who I trust, who, we have a really good working relationship with our patients. And I would imagine that it would be great if we got submissions from other allied health professions that tend to refer and work with, right, which supports that integration piece that you were talking about there, Cynthia. So if you are listening to this, our massage practitioner and work with and refer with a mental health provider, share this with them. You can it's on the Massage Therapy Foundation website. There is a link to the special issue on mental health and manual therapies. The deadline to submit is December 31st of this year. And we have the document to follow along on the Massage Therapy Foundation website. So do you have anything that we should be aware of with this particular special issue? Anything that we might not have touched on yet?
I would think it would be amazing if any educational providers wanted to share their experience teaching, the course structure, the way that, all of those type of things because we haven't really, I guess, talked about that particular part of.
Oh, let's talk about
that. Would be amazing. I'm not sure we're going to get it, but it would be amazing.
So do you mean any educational provider or massage education in particular?
Mostly, I mean, it would be great if it was massage related. I guess in that how they intertwine the mental health aspect, the current way of thinking and paradigms around that biopsychosocial model, pain management, chronic pain issues, well-being, quality of life, all of those things through their teaching, how, just thoughts about how that works, how potentially receptive students are to it, their thoughts on maybe how it's best taught or at what time it's best taught, before hands-on, after hands-on, in combination, all of those type of things, how they see that maybe in a student practice, because you could almost tie in that evaluation piece again with what is coming through student clinics, more mental health, how many mental health, what aspect, those type of things would be.
I think the more we talk about in our various ways, whether it's through a publication, through a massage net or a journal club, or with your colleagues over coffee, this piece, and I think you both touched on it in the beginning, massage is more than just, pushing on tissue, right? And if you think that's all it is, you're missing a really big part of it, right? And work like this and the mental health piece will help inform our schools to how to best apply, one, how to address and have a conversation about it in a safe spot. And then two, is the pace and rate at which they're learning the information as well as receiving the work. That was always a criticism of mine in the school systems. Some people going 5 days a week, they're getting body work every day. It's like, whoa, maybe we should pump. I just have a hunch. I don't have any data to back that up. I have a hunch that being massaged every day when you're 20 years old is going to bring up some stuff that you're going to have to work through. Just a hunch, right? And I think work like this is going to help, either support or shift thinking around, around that. I could be totally off. I have nothing to back it up on. Let's do some work together, right?
Yeah, and relatedly, actually, to both of what you both brought up is some of these massage schools may have surveys that they've done of their students, about
Mhm.
what where are they in their own mental health? How has their massage training affected them? Or what kinds of, pre-post a certain kind of class, how's it affected them in terms of their own mental health? So I think there are pieces that sometimes these massage schools have that, again, if there's someone listening who's on the faculty or directs a massage school and you've got some of that stuff sitting in a file cabinet that could be very helpful for the profession, think about it, take it out, look at it. Could you write up a piece that might really argue for developing a certain kind of curriculum or the kinds of support the massage therapists need in their training for themselves to really be
Yes.
more sensitive massage therapists, right? So yeah, I think, part of what we're getting at, which I love about this podcast, is how broadly people really could approach this issue and how much all of it matters.
And that's why it's important.
Yeah.
All right. Dr. Sarah Fogarty and Dr. Cynthia Price, thank you so much for walking us through why this work is important and this call for special papers for the IJTMB on massage and mental health. For more information, visit IJTMB.org or massagetherapyfoundation.org. Thank you very much, everybody. Have a great day.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.